Greetings, my fellow YouTube nurses. Look, I've been MIA the last 2 months. It's all I gotta say is CVICU. It's crazy, ridiculous, amazing, and overwhelming at the same time. I'm excited and blessed to be where I'm at. And first and foremost, I gotta say this. Thanks for everybody following me from day one when I went to nursing school, graduated nursing school, passed my NCLEX, got my RN license, got a SNF, skilled nursing facility job, then assisted living job, now working at the hospital, the MedSurg tele-nurse, and blessed to be in the CVICU. So I've done all that in the last 2 years. If I can do it, you guys can do it. You guys are following me through my amazing nursing journey. And so now that I got that off my chest, I also want to thank my preceptors who are amazing, cooperative, and patient with me and yelling at me in the corner, giving me constructive criticism while I'm in the fetal position. No, I'm just kidding. They're very, very cool and they're very awesome. I've been learning a lot. So now that I got that off my chest, let's talk about my experiences. I'm just going to explain the experiences I've had on the in the CVICU floor. So my first day I had was a post-op patient from who had a cabbage surgery done, and I was looking at, the vital signs and everything. Boom, shortness of breath, chest pain. I swear my preceptor looked at me and she crossed her arms and said, "Welcome to the CVICU floor. What are you gonna do next?" Woo! So it hit me like a ton of bricks, and you're really critically thinking. You're hemodynamically looking at the patient. You're knowing your meds. You have to look at the patient and know all the patho of what you learned before and previously. So everything, you just got to put and correlate everything together. So it was an eye-awakening situation. So my patient, I was looking at him, he was on blood pressure medication. He's on titrating meds, on pressors. He was also on pain medication, and then all these other meds. So I was looking at that patient. My other patient I had was on a CRT, and where he was on hemodialysis. We had to learn about the ultrafiltration rate, how much we're pulling out, what the net weight is. It's a bunch of things I can explain, but I don't want to get too confusing on this. So I was doing that, and we also had a patient on a rotoprone bed. That is amazing. The patient lays on it in a prone position, and it pushes them back and forth. What it does, it circulates the blood to the lungs so they can breathe better and expand. This patient was also on an oscillator, guys. They told me we get patients that come in with an oscillator once every 6 to 8 months. So it was amazing for me to have an opportunity to see that. And what it does, it makes the breathing for the patient up to 600 a minute. So I'm talking about panting super fast, like that, like a dog, right? So the reason what that was for, the rationale was because we don't want the lungs to shut down, and we want to expand to keep breathing, because we were trying to get the FiO2 up. We're doing ABGs every 2 to 3 hours. We're messing and fluctuating with the numbers. I mean, it was extraordinary. And then he was also on dialysis, titrating all these meds, and it was just amazing what we did with that patient. So he was actually a 2-to-1. My other patient that I had was extraordinary. So this patient was MI. He had a history of a heart disease, and I mean, I'm talking about a lot of comorbidities, correct? So he came in, had a heart attack. They immediately put him on hypothermia protocol. This is cool. We don't see this on the MedSurg floor. All of a sudden we put cooling blankets. We have to keep the patient on a certain degree. And then at that point, you're only shutting blood to the heart and to the brain. The two most important organs that you're shutting blood to, because you don't have time to put blood in other organs in other areas. So you want to make sure the heart doesn't, have to overcompensate and work harder than it really should after a heart attack, right? So that was a protocol for the hospital. That was cool to see. So that was a 1-to-1 patient. Plus he was on insulin drip, so we're checking finger sticks every hour. Then you're titrating meds. He was on sedatives, which was Versed. He was also on pain medication. He was also, and the reason why we give him sedatives is because he's intubated. So he was on a ventilator system. We had to get the ABGs, look at the PEEP, the rate, make sure everything is okay on that machine. On the O2 sats, we're reading the vital signs every hour, and we're titrating on pressors, which is blood pressure medications. We're trying to bring it up and trying to bring it down. So you're constantly going in that patient's room every 2 to 3 minutes. He had a rectal tube, we had a Foley tube, we had an OG tube, we had a feeding going on, titrating like 6 meds, and then also on a ventilator, and then he also was on the protocol to keep him cool. So it was a lot of learning things that I was going through with my preceptor. And those were a couple patients that I had. So when you think about it, on the MedSurg floor, you're doing focus assessments, you're passing meds, and then you're trying to get a hold of the doctor. No, in the CVICU, you're focused on 1 patient or 2 patients. One really critically unstable, and the other one that's, super stable, so you can kind of have 2. They go off acuities and how high it is, the more, the less patients you have. So the higher the acuity, boom, of course, the more critical care you're going to give them. So that was extraordinary doing that, and those were my like 3 to 4 crazy experiences I've had. But I mean, I'm learning so much. I'm hemodynamically looking at the patient, going over patho. I'm putting every piece together, so it's making sense as a nurse, and I'm learning so much. And on my next video, I'm gonna probably break down like a patho part of it. But that was my experiences, guys, and I'm gonna make more videos in the future. So first and foremost, and lastly, did I say first and foremost and lastly? It's okay. I'm a little tired, okay? So I just want to say, guys, thanks for everybody following, subscribing, hitting that like button, and then follow me on Instagram, Nursemendoza7, and follow me on Twitter. That is YouTube Nurse. Don't forget to leave questions, leave your comments, anything like that. Maybe what do you want to do in my next video? Anyways, my fellow YouTube nurses, thanks for following me, hitting that subscribe button. Don't forget to share. Peace.